Hi, everybody. My name's Justine, and I'm the Equality, Diversity and Inclusion Manager. And this week it's National Inclusion Week. And I'm here with Laura Tockell, who works in the National Glass Centre. And she's going to talk to you a little bit about her disability and how that affects her at work and what we can do to support. So, Laura, would you like to introduce yourself to everybody, please?
Hi, I'm Laura. As Justine says, I work at Visitor Services at the National Glass Centre, and my role's mostly customer facing. My disability is multiple sclerosis, so there are a lot of different things that can affect me with that. I'm not going to list them all because there are so many, but things like mental fatigue and physical symptoms as well are common for most people who have multiple sclerosis. Yeah.
So, how has sort of lockdown affected you and the sort of change to working from home, Laura? How has that impacted on you and how you manage your symptoms?
I've been furloughed for a large part of lockdown, so I suppose the main effect with my disability and that is not having a connection with people at work as often as I would like to. However, I have to say the university has been quite good at making sure that people who are on furlough are being contacted regularly and that teams are kept up to date with things. Generally, now I'm back at work, I think one of the biggest things is probably the use of IT, which means that when you have a condition like multiple sclerosis, it can increase fatigue because you can't do what you would do in a face-to-face situation, which is, sometimes take a break from looking at people, and you've got cues from physical movement and body language, etc., and you've got to concentrate constantly when you're doing everything via video call. Also, as you'll know, Justine, with doing lots of training, etc., managing chat can be quite challenging because you've got multiple things to think about all the time. When someone's putting their hand up or asking a question, etc., that can be quite difficult. Um, Also, I suppose as well, things like the settings are not always exactly correct. For myself, I have slight visual problems and hearing problems. So if there are a lot of people talking at once or there's some feedback online, then that can be a little bit challenging. But luckily, most people are really understanding because they're all in the same position. So most people will just let you stop for a sec and sort things out that way. Um, but it's been overall a fairly good experience actually working from home because of the support that's been offered. But I suppose for myself and probably for a lot of other people, one of the biggest challenges has been when there's more than one person working from home. So my wife works from home as well, which means that we can't have all of the equipment at home that we would like to make working comfortable for both of us. There's not enough room for two computer chairs. There's not enough room for two adjustable computer desks. So there's been a little bit of juggling around the most comfortable working conditions there. Um, but for me overall, it's been a fairly positive situation, and lots done to help support with it.
That's really good to hear, Laura. What would be useful, I think, to end on then, as it's National Inclusion Week, is what would you say in terms of providing advice to other team members or to line managers who have somebody with a similar condition or similar symptoms around how to make sure that you feel included in online meetings and generally at work, what would be good for them to offer in terms of support?
I think regular check-ins are really good, which has been happening a lot, especially if you know that somebody in your team does have a hidden disability in particular, because you can't always tell how they are just from looking at them. But you might not actually know that someone in your team has a hidden disability either. They might not have disclosed that. So things like making sure there are regular breaks, even if you're not sure that somebody has a hidden disability or a visible disability for that matter. Because of the amount of screen time, and again fatigue, which is different to tiredness for people who have chronic illnesses. things like making sure as far as you can that settings are correct, you've got good lighting when you're doing a meeting, as far as possible that there aren't too many people on the meeting as well, because then it's harder to distinguish between different people's voices and where comments etc are coming from, and making sure that at home the environment is as comfortable as possible for people. It might be that, I know we were discussing this earlier in the week, some people don't feel like they can ask for extra equipment, etc. They might not feel like they're deserving of that. It's about worthiness, this feeling that sometimes people, especially if they have a hidden disability, don't feel that they're as deserving of those things. So maybe ask even if somebody hasn't said they need those things. And to have the possibility for people to meet outside of a work setting. So like we do on the network sometimes, offer the opportunity of social interaction rather than just work interaction, because it might be that people at home don't have someone to talk to about what's happening with their illness, and that means that sometimes they're just bottling things up inside, and they might not have the opportunity to tell somebody about what's going on. And sometimes it's just really nice to see your colleagues outside of a work setting as well, so that's a nice thing.
Brilliant. That's really helpful, Laura. And just to pick up on something she mentioned there at the end, our staff networks. Laura is part of our Enable staff network, and this provides peer support to people who have hidden or indeed visible disabilities, and also allies who wish to support. So if you would like to be part of that staff network, then please get in contact with me. Thanks very much, Laura.
Thanks.